All right, so picking up where we left off in class, we finished talking about the body cavities in the body, the two major, very large thoracic and abdominal pelvic cavities, um, which are anterior cavities, and then the two posterior cranial cavity and vertebral cavity. Keeping in kind of theme or in line, we're talking about the thoracic and abdominal pelvic cavities. We're going to talk about the membranes that are now or that are associated with those two very large cavities. Um, Reading through, a membrane is a thin, pliable tissue that covers lines, partitions, or connects structures. A thin, slippery, double layered serous membrane covers the viscera, which we learned on that previous slide. Viscera just refers to the organs of those um, thoracic abdominal pelvic cavities, and also lines the walls of the thorax and abdomen. So there's a double membrane. So there's two layers, okay, one of which covers the organs, excuse me, lines the wall of the thorax, so the inside of the chest and inside the abdomen. Okay? The two layers are a parietal layer and a visceral layer. The parietal layer is a thin epithelium that lines the walls of the cavities, and it doesn't say this, but it would be the superficial layer, okay? The layer that's closer to the outside of the body, whereas the visceral layer is a thin epithelium that covers and adheres to the viscera within the cavity. So this is what covers the organs, okay? And thus would be the deeper layer. Okay? Kind of an illustration here that's really pretty straightforward and handy to kind of show those two layers would be, what happens if you were to stick a fist inward on an inflated balloon. The fist would represent the organ, whether it's the heart, whether it's the lungs, whatever. The part of the balloon that is directly touching that organ, in the case this would be the fist, would be the visceral layer, and then the other layer that's not touching the fist would be the parietal layer. Now, between the two layers is what we call a serous cavity, where there's what's called a serous fluid. Okay? So it'd be like what the air would be in this case, or if it was a water balloon, it would actually be fluid. But the function of that fluid is to reduce friction, so that those two membranes aren't rubbing on each other and creating holes, or rubbing themselves to the point where they have scar tissue formed on them and that kind of stuff. So this allows the organs to somewhat slide during movements. Now, there are three major serous membranes: the pleura, pericardium, and the peritoneum. The word pleura or plural, I told you guys on that previous page, always refers to lungs. Okay, so the pleura is the serous membrane of the pleural cavities, and thus is associated with our lungs. Two layers of each of those exist: a visceral pleura, which clings to the surface of each lung, and then a parietal pleura that lines the chest wall. Between them is the pleural cavity, which will be full of what we would call pleural fluid. Okay. The pericardium, remember cardia or cardi in this case, refers to heart, and thus the pericardium is associated with the heart. This is the serous membrane of the pericardial cavity. It includes a visceral pericardium, which actually is the outer layer of the heart and covers the heart itself. The parietal pericardium lines the chest wall, and thus is superficial. Between the two is the pericardial cavity or pericardial space, as you'll sometimes see described as, full of a fluid called pericardial fluid. The largest of the serous membranes is the peritoneum. This is the serous membrane of the abdominal cavity. It includes the visceral peritoneum that covers the abdominal cavity and the parietal peritoneum that lines the abdominal wall. The peritoneal cavity is the space between those two peritoneums, and this is where we find most of our abdominal organs, which would include like your stomach, most of your small intestine, most of your large intestine, a lot of those, very prominent organs down there in your belly area. Some of our organs, though, are actually located between the peritoneum and the posterior abdominal wall, which makes them outside of the peritoneal cavity, or more so posterior to it, if you think of it that way. If you were to do a dissection of the human body, what you would have to do to find these various organs, you'd have to just like basically remove or slide the intestines out of the way. And what you'd find is a very shiny membrane. That membrane would be a parietal peritoneum on the back wall, and you could actually cut it away and find things like your kidneys, the pancreas. Those organs would be classified as retroperitoneal. Retro meaning behind, and peritoneal for the peritoneum. These three serous membranes we will really not talk about much until the very end of the semester. Towards let's see, it would be Unit 7 when we get in. It'll be Unit 6 for the pericardium when we talk about the heart, but the pleura and the peritoneum won't be discussed until Unit 7 when we are talking about the respiratory system and then the digestive system, where a lot of those organs are. So we'll kind of pause on these for the time being, and then refer back to them again much later in the semester. As far as these two pictures go, this one shows the membranes that I talked about of the thoracic cavity. This one was showing the abdominal cavity. I really only include them because they're in your textbook. They're not anything I would ask you to know. And then that brings us to our final slide here, where we can take that large abdominal pelvic region of the body and the cavity itself, or cavities themselves, if you break them apart, and just subdivide them, make it smaller, which is really useful for anatomists, or like doctors, nurses, clinicians, just so, like I said, we do a lot of describing where things are in relationship to one another. If you just say something's located in the abdominal pelvic cavity, that's a big area. So you can make it much smaller and easier by doing one of these two methods. The kind of more sophisticated method is using what we call the abdominal pelvic region method, where you create essentially a tic-tac-toe grid over the abdomen, where you've got two vertical lines, what we call midclavicular lines, called midclavicular lines because they run right down the middle of the clavicle. So they would be just medial to the nipples. Okay, and then a couple horizontal lines. What we call subcostal line runs, costal always refers to ribs, so this would be just below the ribs, and then transtubercular runs right at the top of the hip bone points. Okay, and then essentially what you get are 9 distinctive regions, shown here in a superficial manner, and then without the skin, so you can see kind of where the organs are. We have this picture at the bottom. What is nice is you're really not having to learn 9 distinctive names. What over here on the right side of their abdomen is showing is the same names as what's over here on the left side, except all you remember you're having to do is keep your left and right, their left and right, straight forward. Okay? So as far as the exam goes, you're going to have to know these names, but it's not like you're having to learn 9 specific different regions, because really only learning 6 and then keeping your right and left straight. As far as knowing the lines, the midclavicular lines, the subcostal, transtubercular, I don't care about you knowing those. Just the names of the regions that are already all capitalized. So make sure you can identify them here in this picture. Same thing with this picture, which is another version of it. The only difference between this picture, make sure these last 3 down here at the bottom, they've got 2 terms for each of those. Inguinal-iliac are the same, pubic hypogastric are the same. They only list one of those. So right here where it says pubic, you might put in parentheses hypogastric. For left inguinal, you'd want to put the iliac name in there as well. So maybe put that in parentheses or whatever, in case you don't have to know one of those or whatever. Okay. So nothing too crazy, hopefully there. Much simpler is what we call quadrant method, which quad is a term that always, or prefix that always means 4. This is just creating 4 distinctive, what we call quadrants. That's because there's a vertical line and a horizontal line that make it up, subdividing them up, and they intersect right there with the belly button would be, creating what's called a right upper quadrant, right lower quadrant, left upper, and left lower quadrant. Pretty hopefully straightforward there. a useful example of why this is handy. If a patient comes into the emergency room experiencing right lower quadrant pain, the pain down there um, towards their groin on the right side, one of the first things they're going to check for is to make sure that organ right there, the appendix, is not about to pop. So, um, kind of a clinical application as something that you might experience using if you end up in a clinical setting as a doctor, nurse, or whatever. So, okay, at this point, we were through the lecture, so I will stop the video and shut it down now.